Here we are at the Quinte Mall with the Paramedic exhibit. It's the Hastings Quinte Paramedic Association, and they are promoting all things to do with their call center and how to receive treatment. We have three professionals on here, paramedics. We have Kelly, we have Tim, and we have Glenn. Say hello to Mixed Nation, guys. Thank you. And I see that we have somebody who's in need of medical attention. Tim, since you're the man of the hour, what are you promoting here at the Quinte Mall over the weekend?
Well, we're just promoting, it's EMS week, so we're promoting our profession. A lot of times people don't get to see paramedics in action or at work. You know, a lot of times you hear about crashes or things that happen, and you turn on the news, you see the fire truck there, you see the police car there, but we're long gone, and people don't really realize that we were there too, and the work that we do. And our profession has changed quite dramatically over the last even 15 years or so.
You're no longer an ambulance attendant.
Exactly.
Or an ambulance driver.
Exactly. We do more than just drive the ambulance, right? So we're here to kind of promote the skills that we can perform and educate people on the interventions that we do.
And what do you do? Because it's almost like you're not a doctor, although you know a lot of doctor-related things too, right, Kelly?
Yes, for sure. We have medical training that allows us to intervene in emergency situations, sort of like the in-between between the person who's sick and the emergency room. So we can do a lot of things on scene to help.
So what is this victim suffering from, Tim?
Well, this would be your typical trauma victim here. So in this case, we've had to use spinal precautions on him. We use a C-collar here, we put him on a spinal board, tape his head down, strap him to the board so that we don't cause any further injury to any sort of...
This guy's in rough shape.
Yeah.
Everything possible has happened to him.
He's unconscious, so we've had to maintain his airway. So we use a tube here to insert right into his trachea, and we get oxygen delivery right into his lungs.
Do you ever get freaked out, Tim? Like, seriously, when you come on the scene and people are screaming, and like, how do you maintain your cool when people are like, you know, feeling a lot of pain?
Yeah, it's
how do you maintain your emotions?
Very stressful, but you know what? That's why there's two of you on the call, right? You kind of lean on your partner a little bit, and you work together, you talk to each other, and it helps having...
So if one person freaks out, Glenn?
Usually that doesn't happen, but they have the partner there to reassure them or help them out if they overlooked a step. Or
ever been sick?
Much cover each other's back. So.
Ever been sick?
Have I ever been sick?
Yeah.
Had the cold and flu.
No. You get on the scene and you're like, oh my God.
No.
Never? Got a good stomach?
I've never been sick on a scene, but we do get a wide variety of smells and.
Yeah.
For sure.
You kind of know what's coming in front of you by the smell, right? Before you open a door, before you're like, all right, I know what this is. Do you get used to it?
We're very well trained, is what it comes down
The
to.
procedure helps with that. We have a job to do. We're not just bystanders looking at an ugly scene. We have procedures to follow, and that helps us to work through. We're not just worried. We have a job to do. So I think that helps with the traumatic situation. Once we're done and we package them and send them to the hospital, sometimes afterwards we sit there and go, ooh, that wasn't so great. But during the call, honestly, we have a job. So.
Well, you do your job well.
Thank you.
You do your job very well. So the three of you and other paramedics will be here at the Quinte Mall. Come down and check them out.